Good morning and welcome to today's session, Climate and Health Equity in Action. I'm Ben Fulgencio-Turner, the Director of the Climate for Health program at EcoAmerica. We are here at Climate Week in New York City to discuss the health equity impacts of climate change and, even more importantly, how climate action can help to address persistent health disparities. Before we get started, I want to thank our host, Sun River Health. This Bedford Avenue Health Center in Brooklyn is a beautiful new health center serving a community facing significant health disparities as well as increasing exposures to climate impacts. And thank you to the National Association of Community Health Centers for helping to organize this panel and providing the breakfast as well.
So I will just talk a little bit about EcoAmerica. Where I'm the director of the Climate for Health program at EcoAmerica, and EcoAmerica is a nonpartisan, nonprofit organization committed to driving social action, the social movement for climate action and momentum. And we do that through three major programs, all aimed at engaging local community leaders who have the most trust and connect with people on issues that are relevant and local to them. So I direct the health program, which has over 50 institutional partners, including NAC, Sun River Health, APHA. We're really proud of this work, and I'll just say my background is working in safety net healthcare, and so it is really clear to me and really obvious to me that the community health centers, safety net health, needs to be at the center of this conversation. That not only are the impacts affecting these communities first and worst, the folks providing the care, the folks representing these communities, have an understanding of how these intersections with existing health inequities and social determinants of health drive greater and greater disparities, and how solutions can help to multi-solve some of these problems and address health disparities while also taking action on climate. So that is why I'm so excited that we were able to have this panel at Climate Week here at a community health center in Brooklyn. Really quickly, I'm just going to introduce all of our panelists before I hand over the mic. So first is Ann Kaufman-Nolan, the Chief Executive Officer of Sun River Health, our host. She has guided Sun River Health from a single primary care site to a network of nearly 50 federally qualified health centers, serving over 250,000 patients throughout the Hudson Valley, New York City, and Long Island. They are a true leader in the space of community health centers and climate action. We also have Zoya Turstein, an award-winning journalist and staff writer at Grist, covering the intersection of public health and climate change and the politics of climate change. Zoya has written about climate impacts from communities in Alaska to Louisiana, as well as the local and national responses. Dr. Julian Watkins is a physician and the Assistant Commissioner of the New York City Department of Health and Mental Hygiene Bureau of Health Equity Capacity Building. He supports citywide efforts to promote community wellness, reduce health inequities, and empower communities through tailored engagement, narrative power building, and community-centered program design. Julian is a Climate Health Equity Fellow with the Medical Society Consortium on Climate and Health and a Robert Wood Johnson Foundation Culture for Health leader. Jessica Hinshaw is the Environmental Health Director of the National Association of Community Health Centers, or NAC. NAC is the National Association of Community Health Centers, like Sun River Health, that provide healthcare to over 30 million Americans. And in addition to leading the climate work at NAC, Jess is also a doctoral student at GW with her thesis focused on supporting community health centers to build climate resilience. So focus on this 24/7. And then Catherine Catalano, last but not least, is the Deputy Director of the American Public Health Association's Center for Climate, Health, and Equity. And in this work, she applies a health equity lens to help shape climate policy, engagement, and action.
And now I'm excited to invite our first panelist to the podium, Ann Kaufman-Nolan, CEO of Sun River Health.
Oh, thank you. Thank you all for being here. Thank you, Ben. And I feel it's so much a part. This is a really distinguished panel. I'm so pleased to have you here, all of you at our newest site here in Bedford, in Brooklyn. As you mentioned, we have 50 sites around, and this is the newest, and we're so pleased to have you here. Fernando Soto, Fernando, where are you? Here you are. Stand up. Is our health center director here, and he agreed to take you on tours. If you have a minute after, the health center part starts over here, and then we're all around, woven around there. So thank you, and we really look forward to this event we know there's so much going on in New York, and thank you for choosing to come here to hear about climate and health and community health centers from me. We really want to thank Eco America and NAC, as always, the National Association of Community Health Centers and health centers go together. And I've been a member for nearly 50 years, as I have been in the health center world for that long. Sun River Health began in 1975 as a grassroots community effort for African American women. Started the health center as a community effort to see that affordable, accessible healthcare was provided for everyone in the community. That's what a community health center is. And I joined the team in 1977. You have to bear with me. Sometimes I get 19 something and 20 something mixed up because I go back for that length of time. And today we are a network of 50 community health centers throughout the Hudson Valley, all of New York City, in every borough, and Long Island. Mainly focused on the east end of Long Island with our number of sites out there, and started there serving agricultural workers. That's how we got our foot in the door to do the care in Suffolk County. We provide primary care, including family medicine, pediatrics, women's health services, dental, behavioral health, and more to over 250,000 people annually through 750,000 visits. They come to our health center to see our physicians, our clinical staff. We have 2,000 staff, providers, and others who are making this all work. And this is perhaps a climate specific statistic that we occupy 750,000 square feet of space with over 650 patient care exam rooms and 5,000 square miles in our region. It's a lot of distance and a lot of exam rooms and a lot of space to be thinking about. And if you're not familiar, I know you will be more familiar after Jessica speaks, but just to say how proud we are to be part of a movement, a community health center movement that serves 1 in 11 people in the United States and serves a total this past year, my data is correct, Jessica, 31.5 million people. Each of these millions of people that we serve are highly vulnerable to the effects of climate change. The populations we serve that I like to talk about, just specifically because I think we're very pleased to be serving 8,000 this is 8,000 out of a million, by the way, that are being seen in 8,000 agricultural workers. That's out of a million in the country, which I love to think about. We went over a million as a national movement in serving agricultural workers, to 24,000 people living in public housing. In our case, 17,000 unhoused are part of our, and the old, you have to forgive me, the old terminology, or homeless people. And we know that we're changing our language to be more in keeping with understanding the situation of people who who don't have a house. And we also serve a number of other special populations that you can see from the slide. Now, the point of social vulnerable populations are really less able to prepare for, to respond to, and to recover from the impacts of climate change. These are the populations that we serve. This site in particular generates a medium high ranking on the CDC's Social Vulnerability Index. And I'm learning about these things as we go, by the way. This is not a language that I am so familiar with. So if I make a mistake, I have 2 experts on my staff, Jenny Nolan and Ben Bolton, who've worked with me now for many, many years on climate change and who keep me straight. But just in case I make a mistake, they'll correct me. So the Social Vulnerability Index accounts for 4 major areas of social vulnerability. 1, social economic status, household characteristics, racial and ethnic minority status, and housing type and transportation. I think those are very important measures that determine this social, the vulnerability scale. As a community health center, with 51% of our board of directors patients. Our efforts started with the board engagement years ago. But by 2022, we developed a board pledge recognizing the significance of climate change to our mission and pledging to address head-on reducing our climate footprint, preparing for climate impacts on the people we serve, and leading the way to a low-carbon future. To live our values of a sustainable future, we're committed to addressing systemic inequities. Our goal is to become carbon neutral by 2050. Over 86% of our health center patients live at or below 20% of the federal poverty level. And we realize how true it is to say that a person's zip code is often a greater environmental determinant of health than a person's genetics. In our Bedford site, which we've studied because we're to show you local impact. Now, we've only been here for 6 months, and all of our sites share elevated risks to effects of climate change, but this site in particular has been identified by DEC as a potential environmental justice area and as a disadvantaged community by the New York State Climate Justice Working Group. 18% of the population in the community are at or below the poverty level, and 11% are uninsured, higher than both the state and national average. You can also see as that Bedford alone is subject of both the geographic and social risks related to climate. It's within 4 miles of 2 Superfund sites and suffers air quality, heat, and hazardous waste proximity exposures. There are elevated disease burdens as a result, including vector-borne diseases, asthma, cold, and heat stress. Given the impact of climate change on health, we really must act. When I look at the cost of inaction, it's hard to bear, over $820 billion per year nationally. We think about the healthcare costs of inaction, and these costs come from the premature deaths, medical care, rehabilitation and home care, prescription medications, lost wages and productivity, and downstream health costs. We're also quantifying the need here in Bedford in only 6 months after we opened that we've seen 1,000 visits. The data from these 1,000 visits indicate that 83% of our patients receive Medicaid and are uninsured. Now, if you remember, the community profile shows 18% of the people in the community are under the poverty line. This Medicaid and uninsured is a close indicator of the percent living under the poverty line, and we say 83%. So it's quite a disparity, but it is what community health centers are about. That's why we're in this community. It's not by accident that we serve, that we're located in the poorest communities, because our goal is to help to revitalize communities at the same time that we're providing necessary access for patients, for new patients. And that's why we've had a commitment to expanding access, because when we go into communities, we can help revitalize, we can help change communities and provide the most important thing, a place for people to go to get access to health care. When we compare our patients here in Bedford, the total population of to the total population of Sun River Health and New York State, we see that Bedford has a higher percentage of disease burden, chronic kidney disease, hypertension, and cardiovascular disease. Climate change is expected to exacerbate these chronic conditions. And let me just explain a little bit further what I mean by the local climate projections. There's heat vulnerability is an issue. This site is located within an area that is rated highest risk for heat vulnerability, which will be exacerbated by increasing temperatures. We have increased heat and heat waves that may lead to higher energy demand, thus increasing PM 2.5 emissions from local energy generation. That's particulate matter emissions at 2.5. And further, acute events like the June 2023 Canadian wildfires, I don't know if you remember, but I remember how hard it was to breathe. Smoke, the wildfire smoke dangerously impacted the city's air quality in the short term. We also anticipate an increased rainfall, and temperature in New York State is also anticipated to increase disease-carrying insects. Well, what we value here at Sun River Health is to place the patient in the center of care. This is our vision statement, our North Star, if you would. We approach climate change with a focus on where we can create the greatest impact. Sustainability and climate change wrapped all around in the outer layer of this, really focusing us on integrating in our quintuple aim the measure of sustainability and resilience, and making sure that we are putting forward programs and that we are conscious of our impact on climate and our patients' impact and the impact on our patients. Responding to climate change is central, really, to providing care and value to our patients and our communities. So you're likely aware of all the people that are in New York, the 1,000 leaders from businesses and government talking about Climate Week and at least 600 events. The volume of information around climate change and sustainability is really high. Even as one of the largest community health centers in the country, and with our commitment to sustainability, it's impossible to absorb it all. Keeping our patients as our highest priority defines our approach to taking action. And with this in mind, we've really adopted an approach of rational sustainability, the approach defined by Alex Edmonds, listening to our stakeholders across the spectrum and focusing on what is material to the health of those we serve, and balancing our available resources with what we can do to address our patients' needs. And finally, while we've gone on with facts and figures and complexity of sustainability, the ultimate starting point was made by Michelle Williams, who's former dean of Harvard School of Public Health. Health is the human face of climate change. Once we acknowledge this, everything else is possible. So thank you so much for your time.
Hey everyone, thank you so much for being here. My name is Zoya Tierstein. I'm a reporter for GRIST, which is the national online magazine. We focus on the environment, and I cover climate change and human health. I'm here to provide the national perspective, and I will be short because it's incredibly depressing. In the 1970s, the CDC was so confident that it had beat back infectious diseases, that we had conquered that as a country, that it started firing its infectious disease experts. And having them focus on genetic conditions instead. And then a bunch of gay men in California became sick with AIDS. It feels like we are in a similar moment now, where we are experiencing a moment of hubris. We think we can control the environment. We think that we've beaten back diseases in this country. We're wrong. Climate change threatens to undo 50 years of public health gains. And we know, and you all know better than most, that the world has made enormous strides in the past 50 years when it comes to health. But that threatens to be undone by climate change. I had been covering politics prior to 2020. That Lancet report that you also referenced came out. And I initially started covering this issue sort of sporadically, a Lyme disease outbreak, or a spike in cases in Connecticut, and then a fungal pathogen in the desert Southwest. And I treated these outbreaks as sort of one-offs, how rare, how strange, how odd, how unlucky for those people. And it was only recently that I discovered that all of these things are very much connected. that rising temperatures and worsening weather patterns and hurricanes are stirring up and moving carriers around the US in ways that are unpredictable and break through our public health defenses. Part of the issue is we have a country that's so vast that we don't have a unified approach to tracking, surveilling, and warning communities about these issues. And so what we're seeing now is sort of the first, what can be described as sort of the first assault on human health due to climate change in the US. We're watching people get sick and die from heat, yes, those direct impacts, hurricanes, et cetera, but also these indirect impacts, cases of a brain-eating amoeba that killed 2 toddlers in 2 years. So it's random, seems horrible, it is, and this is just part of a larger trend. Um, Valley fever is moving throughout California, up into Washington state, where it never was found before due to warming temperatures and more erratic weather patterns. And so all these things are connected, and that's really what I'm here to talk about, is sort of the pattern that we're seeing and the fact that many people are not yet aware that this is part of a trend, that these things are going to get worse, that communities need to be warned. And of course, in the US, we're very lucky that we have comparatively a lot of resources. In the global south, we're seeing horrible outbreaks of dengue fever, for example, mosquito-borne illness that is killing people all across the Americas and elsewhere. We're seeing really in the global south the like sort of a very intense manifestation of the climate-driven impacts, health impacts. And so I think that part of my role as a journalist is just to call out these connections, to figure out what percentage of these cases that are on the rise are due to just better monitoring, doctors who are more aware, et cetera, versus how much of that is actually due to climate change. And that's what I've been doing for the past 3 or so years at GRIST. And I'm excited to talk about not just the sad stuff, but also the moments of hope, which are scattered all throughout the country and elsewhere across the globe. Doctors who are taking on these issues, medical communities that are launching programs to help communities monitor these impacts and react to them. And then, of course, the political headwinds that get in the way of all of that. Politics always gets in the way of good policy, and I've been watching that play out in real time. So thanks very much, and I look forward to the conversation.
Good morning, and welcome to Flatbush. My name is Dr. Watkins, as was stated earlier. I'm one of those physicians that's taking on climate change as a public health issue. What I want to offer today is a little overview of the issue. We'll hear a lot during Climate Week, and on the panel, we'll talk about all of the things that are going wrong, but I do want to offer folks a glimpse of hope. I would say an off-ramp or an intervention that I think would be really that is necessary and urgent for the times that we're living in, and it comes in the form of health equity. Before we get into the presentation, I want to offer this definition of climate justice. I think it's a very important part of the conversation as we're talking about climate change, as we're trying to unpack this thing. Some of us may be new to this work. Some of us may have been in here, may have been at this table for a long time. But as we're unpacking this issue, the issue of justice comes up. And so the definition of climate justice is this essentially this recognition of the historically overburdened communities that are most vulnerable, and this question of why, understanding how these persistent issues are contributing to these health inequities, and also how climate is an accelerant, how the changing climate in these various ways that the world's atmosphere is changing. Those things contribute to human beings. I like the analogy of we're like goldfish in a bowl. If the environment itself is dirty, if the water is dirty, and you can't clean that water, of course, no matter how healthy the goldfish is, the goldfish is going to be impacted. And unfortunately, humans are like goldfish in a way. So the climate hazards that we're facing in the New York City region across the Northeast are extreme heat, coastal surge flooding, vector-borne illnesses, and poor air quality. And as we think about all of these issues, so diverse, but they all kind of converge on certain communities, the story of extreme heat in New York City, I think, is really illustrative of this issue and can really help us understand and unpack how this actually plays out in real time. When we think and talk about climate change, it's often polar bears, ice caps, and that is real and they are important, but there's also a lot of climate change and a lot of issues and injustice right here in our cities and out on the streets in Flatbush. So we'll talk a little bit about heat in heat deaths, extreme heat in New York City. And as we said, we know, historically overburdened, marginalized communities are experiencing an unequal impact of heat. And when we look at the data for heat in New York City, it's really clear. When we look at the demographics, we know that folks who identify as non-Hispanic Black folks are dying at rates twice as high as other folks. We also understand that biologically there is no difference. So there's some other factor at play here. We know that heat stress occurs across various different age groups, but we see our older folks are the most impacted. If you look to the right, I think this is the right for you. Yeah, look to the right of the bars. You can see folks 80 plus, and it's stepped down. Each rung you go up the ladder in age, the higher the increase of your risk for heat stress. So when we look at it, it's older folks, it's Black folks, and there's a gender gap as well. We see that male identified folks are dying at higher rates. So it's older Black men who are dying in our city, our neighbors, our uncles, our brothers, our friends. And and if we really look at this situation, we can understand again that this is an injustice. When you look at the map of New York City, we do a lot of surveillance, and you can check our NYC Health website and check some of the surveillance that we do from diseases, but also we also report on heat and heat vulnerability. So we have a measure called the Heat Vulnerability Index. We look across the 5 boroughs of New York City. We look at the different neighborhoods, and based on various factors, ground surface temperature, amount of green space, access to home ACs, we're able to actually look at the vulnerability of the neighborhoods. And so what you're seeing on the map to the right of the 5 boroughs of New York City, the deeper red represents higher heat vulnerability index. And if you look on this map, you can see where the heat is being concentrated. So if you look up north in the Bronx, northern Manhattan, you see this concentration of heat. You also look to, central Brooklyn, where we currently are today, you'll see that Flatbush and the surrounding areas are also these, pardon the pun, hotbeds of heat vulnerability. You see the similar patterns in Queens and in northern Staten Island. When we look at the other health inequities that are happening across the city, you can overlay the maps almost perfectly. So to the left, you can see a map of the New York City neighborhoods that were disproportionately impacted by the COVID-19 pandemic, by this first wave. I view this map identified by the Task Force for Racial Inclusion and Equity, a citywide task force of diverse leaders across the city. You can see again these neighborhoods, this concentrated impact of COVID, where more than 50% of the folks who got infected with COVID and died from COVID were in these 33 neighborhoods. Um, you look to the right of the map and it tracks on something for even like younger folks who were just born into the world. You can look at the map where the higher infant mortality rates are in the darker purple. So you can see in this darker purple, again, in Flatbush, in the same parts of the Bronx and in the same parts of northern Manhattan and Queens, you see these similar patterns. I want to call folks' attention to the image to the right. You see that light blue tracing around the areas. That's the catchment areas of our bureaus of neighborhood health. New York City actually has 100 years plus history of working on neighborhood health. Before the federally qualified health center model was established, we've been in post World War II. We started with our first health action center in the Harlem area. And so we have health action centers in the Bronx and in Brooklyn. And you can see this model has been in place in New York City for over 100 years. And in the COVID outbreak and in response to climate, these centers do serve as a key function and this role in neighborhood health. All of that to say, there is a lot. Hold on, let's see. Trying to get this animation together. Yes, So when we think about the impacts of climate change on human health, there's a lot. And as a physician, I myself did a 1-year fellowship. So I will not give you all of those details today. You hopefully will have already begun that journey. But when we look at how complicated and how intersectional and how complex things are and all of the climate threats that are facing us, I think that what I want to offer today is a framing and an intervention, a way to actually look at this and make sense of this issue that I think is required. And I think in our current kind of status, in the current way of doing things, that we need a new way to look at these issues and to understand something that is so complicated. Climate change does not live in silos, as we kind of silo ourselves in our world, in the way that we approach healthcare. Climate change does not care if you're an otolaryngologist or a neurologist. It will bring a patient to your office and you have to figure that out. And so it requires a new way of thinking, a more integrated and intentional way of thinking. And that's where the intervention of health equity comes in. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences. I highlighted removing obstacles to health because health equity is an action word. Often when we have these conversations and discussions, it's talked about as something, this concept, this thing that's in the sky that we're talking about, we're talking around. Nobody knows how to do it. We know some people are experts, we think. There's no certification in it. And we've seen how when things become a trend, some people hop on a bandwagon. But I really would like to offer a more deeper, rich understanding of health equity as this intervention, as a way to look at the issues of climate change in a way that makes sense and is more responsive and sensitive to the social and historical and political issues at play. So the power of health equity, beyond just this concept, that's a lot of nice, beautiful, fancy words. I really think about that issue of justice. I often use the word justice. I've replaced health equity with health justice in my work often because people understand it. They feel this word justice. Unfortunately, a lot of the folks who are marginalized, people who come from this experience, we know what it feels like to be denied justice. And so when we think about this word justice, that is a way to really call people in to understand that that's the work that's required. So when we think about health equity, it's more than just a word, it's also this set of ethical and human rights principles that are being used to motivate these efforts to eliminate these health inequities. It's calling out and naming and calling for accountability for the causers of the harms and accountability for those who have been victimized. Health equity is also a lens to help us really illuminate all the disciplinary knowledge gaps, all of the things that we've turned away from in our studies. When we think about the role that race, this unbiological concept plays in our world, right, and how our cities are designed with a racial intention, it's time for us to really move beyond this kind of old world, medieval view of certain people deserve certain things, certain people deserve to be in certain places, a certain treatment, to let that go. It's been disproven, we know better, we have to do better and really illuminate and get to the point and really fill in some of those gaps. And some of the mental models that we jump to a lot of conclusions. We have to really examine what that means, not just for the folks who have been marginalized, but for the folks who have not been, for the folks who have been at the center, who haven't really studied and unpacked what's going on there, and how is it that when we see injustice, we are unmoved. Health equity is also the corrective actions taken. So it is work. It is daily work. It is hard work. It's a work that requires a daily commitment to actually to do the work to demarginalize folks, to actually center folks. It's not a passive thing. Health equity is not this colorblind issue. It's actually sensitive to the historical and the contemporary context that people are living in. And it's really about health equity and resource distribution in the way that we're thinking and talking about policy from the beginning. The programs that we develop, our emergency response, how things are implemented, but then also how we're evaluating our work and ourselves and the standards that we are measuring our success. And I think finally, as I close, health equity is a movement. Health equity is building on, and it's in conversation with decades of scholarship, these intersectional justice work in other fields, but also within our field. Often they're not really looked at as this larger movement. But when we look at this justice work and the scholarship of the critical race theorists, when we look at the philosophers, when we look at other folks doing this work, we can understand how rich and how robust it is. We can also understand that other folks look at and perceive things in a different way that may help us look at and perceive things differently. And so really when we're thinking about this conversation, we're talking about climate change and what can we do? If there's one takeaway, it's that the answers to the hardest questions are not unknown. What we have to do is to build our ability and our capacity and our vision to understand and really see these things, and to dedicate ourselves and commit ourselves to do that hard work, as uncomfortable as it may be, as hard and arduous as it may be. That is what is required. So thank you very much. Happy for the panel. Thank you.
Wow, that's going to be so hard to follow. All of these amazing speakers. Thank you so much to Sun River for hosting this wonderful event. Thank you so much to everyone being here. Thank you, Ben, for putting us all together today and saying, hey, we need to do an event at a health center, because this is the first time that health is being addressed at Climate Week in this intentional way, for the very least. So my name is Jess Henshaw, and I'm the Director of Environmental Health at the National Association of Community Health Centers, or NAC, because that's kind of a mouthful to say over and over again. And I'm just going to kind of re-highlight a couple of things that folks have already set up here, but kind of three main takeaways that I hope you take from my very short presentation are: one, community health centers are an important piece of the puzzle when we're talking about addressing the impacts of health inequities related to climate change. The second, I want to highlight some stories of hope, like you mentioned, that are already going on at health centers, and also demonstrates the power of partnership. And I think us as a panel, we're already demonstrating the power of getting all of these different voices at the table working on this issue together. Here we have represented health centers, we have nonprofits, we have journalists, we have public health, we have government, just all represented in this space. And there's a lot of health centers who are working on establishing these partnerships to address these issues, as well as those social drivers of health. And then the third thing, for any health centers that are listening in, or you're here in the room or you're online, I want to leave you with some resources that we're developing out at NAC with our partners. Okay, so Anne already did a great job explaining all of this, so I'm not going to spend too much time, but I will zoom out a little bit because Anne portrayed a really great depiction of what a health center does. Community health centers, which include federally qualified health centers, actually started as neighborhood health centers under Lyndon B. Johnson, as a demonstration project under Lyndon B. Johnson's War on Poverty. And health centers have this incredible history tied to the civil rights movement, to the farm worker justice movements, all across this country. And so we have some updated data. So this just came out. Health centers are providing primary behavioral and dental health services to 32.5 million patients across the United States. That means that 1 in 10 folks that live in the United States are health center patients. That's a huge number of people. And our goal is to get to 1 in 3. And so health centers have over 16,000 different service delivery sites across the United States. So we act as one of the largest primary care networks in this country. And like I said, Anne really drilled down and showed you what a day-to-day looks like here at a health center and the types of patients that health centers serve. And Dr. Watkins had this up on his slides, but I just wanted to reiterate and re-highlight that health center patients are the ones that are hit first and worst by climate change. Health centers, over 90% of the patients that health centers see across this big network of health centers are folks with low income. Over 60% represent communities of color or ethnic minorities. They provide services to older adults and to pediatric patients. So, just trying to make the case to you, please bring these health centers in when you're having these discussions of about how to address health inequities or include them in on climate conversations, because they know these patients and they have the resources to reach them and communicate with them about climate change. So now this is the point where I want to get into some of these stories of hope. Within the health center statute, which is Section 330 of the Public Health Services Act, health centers are actually authorized to address environmental health issues related to air and water quality. And we know that climate change exacerbates these issues. So it's really embedded in already what a health center does. And so I want to just highlight amazing examples of health centers already doing work at the nexus of climate change, addressing social drivers of health, and those issues that are just beyond the health center walls. I didn't include Sun River here because I knew Anne was going to do a great presentation, but I just wanted to say that Sun River and the health centers that we work with across the United States are really integral to forming what we're doing at the National Association of Community Health Centers. I've had so many conversations with Ben Bolton from Sun River, and he's really guided our work. So these are just some of the examples that are going on, but there's a lot, lot more stories out there of health centers doing this work. So the first one is La Clínica de la Raza in Oakland, California. They were impacted by the wildfire smoke of 2020, of all the wildfires that were going on in Northern California. So they started a climate change working group in response to this. And they have some focus areas that they're working on, which you can see on the screen. And most importantly, preparing patients for climate change. And so they are very active they started a working group within their health center, and they also are active at the state level in their California Primary Care Association working group as well. And they have great community initiatives. One of those being, I can't remember who mentioned this. I think it was Zoya, maybe mentioned alerts to communities, but they started air quality and heat wave text alerts that go out to their patients in their patients' preferred language. And this was through a California EPA grant that they were able to pilot this program. They also have a Nature RX program where they take their patients out into nature to allow them to get the benefits, both the physical and mental benefits of being out in nature. And they've incorporated community health workers into that program as well. And they're also installing solar panels and backup battery for their clinics because we know, as Dr. Watkins portrayed on the screen, we know that climate change is causing an increasing frequency of these climate-fueled weather events. So they want to be prepared for any blackouts that their health center has. They want to be prepared in the case of a climate event that they can keep their health center up and operational when it makes sense for staff to be at the health center during those events. The next one that I want to portray is a health center that's doing some really great work at the intersection of food security. Again, going back to that graphic that Dr. Watkins put up, we know that climate change is already impacting and will further impact food security. So Lawndale Christian Health Center in Chicago has developed this unique partnership between a local food bank, the Botanic Gardens, and the health center, and they have created an urban farm that is using aquaponics to make the farm sustainable. And what they do is provide prescriptions, vegetable prescriptions for their patients to go and get food from this farm. And then they also have cooking classes at the farm, and they have a job program for formerly incarcerated people who are entering their community. So it's just a very unique and comprehensive model of what a health center is doing in this space. We also have Crescent Care. So this is going back to the fact that we're experiencing increasing climate-fueled weather events, increasing in frequency and severity. So after the aftermath of Hurricane Ida in New Orleans, a group of nonprofits, this included Crescent Care as a health center, as well as faith-based nonprofits and other nonprofits in the community, got together and they said, this hurricane was horrible. People died. What are we going to do about it? And so they formed a coalition through Together New Orleans to establish the Community Lighthouse Initiative, which is a distributed model of resilience hubs. So Crescent Care, as the health center, has installed solar panels and backup battery systems. There's also churches. There's also other organizations that have all installed solar panels and backup battery systems so that when a hurricane happens, when a heat event happens, when the power gets knocked out in New Orleans, which is unfortunately all too common, people are able to ideally walk to one of these community lighthouses, which is a resilience hub, to receive services from food to primary care to shelter. So it's all there, and it's a really unique initiative. And they just tried it out actually with the hurricane that came through Francine, I guess, a couple of weeks ago. And there are some really good reports about how that functioned. And then I'll just get it, I won't spend too much time on this, but at NAC, again, this is highlighting partnerships. All that we're doing, all the resources that we're developing are really through very strong partnerships. So first and foremost, we have partnerships with health centers for our interest group. So if you're a health center, please feel free to join us. We meet in person, we meet every other month online. And it's just to share resources, hear from each other, hear about the pain points and the solutions that we're all bringing to the table together. We've been able to work with Eco America to establish a Climate for Health ambassador training that is tailored to health centers and highlights health center stories. We've done a lot of different work on extreme heat and climate fueled weather events, working with our partners like AmeriCares and Harvard and the CDC to bring different resources to health centers. And then finally, a big one that we're working on right now is solar panels and backup battery storage to extend that resilience hub model across the United States through our Community Health Access to Resilient Green Energy Partnership, or CHARGE. And I'm going to spend a little bit of time talking about that. So that's a partnership between Capital Link, Collective Energy, and NAC. And basically what we're doing is we are providing kind of a one-stop shop for health centers to come to us. We provide education and resources about solar panels and backup batteries. We provide free systems design. We can hook up health centers with installers, and then Capital Link can help secure loans for health centers to install these solar panels and backup battery systems, as well as we're looking for funding. And we actually have secured a big award through the Department of Energy to install solar panels and backup battery systems in the rural Southeast. So if you're working there, you're a community health center in the rural Southeast, let me know. I'd love to be in touch. And then this is just a map that's demonstrating that health centers are really buying into this idea of solar and storage to build resilience at the health center. So right now we have 27 different health centers who have completed installations of solar panels and backup battery systems across the United States. But this number is going to pretty much double in a year from now because we have a lot that are under construction. So we have this map available on our website. And then finally, just would love to get in touch with you. So we do have an interest group that meets, like I said, every other month and in person. It's really tailored to health centers, but we welcome all to join us if you're interested, because it takes a village, it takes a team, it takes a lot of partners to be able to do this work. So thank you, and I'll turn it over.
Great. Good morning, everyone. Thank you for coming and having breakfast with all of us. I am so energized by what everyone is saying, that beautiful map of all the new solar projects, all the different work folks are doing here. I think Climate Week is also always a very energizing time. And, it's this mad dash of all of these events, often with a national and international scope. But it takes place here in New York City. So I'm so happy we were able to really highlight local work being done on climate, health, and equity here. In the city that is hosting this event each year. I think that's so important. And, just like Jessica sort of provided a zoomed out view on Anne's presentation and the work done here, I'm going to provide a little bit of a zoomed out view on Dr. Watkins's presentation and the wonderful work that New York City Health Department has been doing to address climate, health, and equity here locally. So I will start by introducing myself and my team. I run the Center for Climate, Health, and Equity at the American Public Health Association. This is our wonderful team, almost all of whom are here in the room today. I'm very excited about that. So look for these faces and feel free to ask questions or chit chat after the presentations. But American Public Health Association, we overall operate as a public health advocacy organization. We work to push, public health policies to work in a number of different areas, including climate and health equity. But we also function as a professional association for public health professionals across the country. We have 24,000 members across the US and US territories. We have state affiliates across the country. There is a New York Public Health Association, a Maryland Public Health Association, et cetera, that we also work to resource and support their work in a number of different ways. And I really want to talk about today our work working with supporting the CDC's Climate and Health Program and their Climate Ready States and Cities initiative to support and resource state, local, tribal, and territorial health departments across the country. Including the New York State Health Department is a grantee of the CDC's program. A lot of the time when I talk about this work and how important it is for health departments and public health professionals to address this nexus of climate, health, and equity, I start with, unfortunately, many of them do not have the dedicated resources or staffing to do this work appropriately. A lot of the public health workforce in this country is extremely overburdened and under-resourced to do this critical work. And I'm very, very happy to say that New York is one of those places that does receive dedicated federal funding and that does provide, the state health department receives that funding, provides workshops and communications materials and guidance to all sorts of local health departments. So a happier story here than I usually tell. One of the ways that the CDC helps to enable this work, in addition by providing that funding, is to create guidance and resources for health departments across the US to engage in climate resilience work. This is the BRACE framework, building resilience against climate effects. This is a 5-step process that allows health officials to develop strategies and programs to help communities prepare for the health effects of climate change. This is what has been the main sort of center of all of that guidance. But there are lots of trainings and materials on their website and on ours, including the Climate Change and Health Playbook, which we developed for the CDC and their grantees and health departments outside of that program, designed to support the work of state, local, territorial, and tribal health services in embedding justice, equity, diversity, and inclusion into their climate and resilience initiatives. It's meant to fit within that 5-step BRACE program. And I'm happy to report that this will soon be obsolete. So I'm showing it to you here, and you can go ahead and take a look at it on our website. But something I'm really excited to sort of preview for you all today is, well, no, am I pointing the wrong way? Oh, cool. Well, that was a little bit of a network connection. I was like doing a drum roll, basically. Anyway, so the state health departments help to enable work at the local level and do a lot of their education and work through the BRACE framework. And we've been working for a few years now with the CDC, not only to embed these justice, equity, diversity, and inclusion principles and guidance into a new BRACE 2.0. But we have also worked with lots of different technical experts, with grantees and other health departments that are doing this work across the country and their community partners to really embed the importance of partnership, of community engagement, to create a more flexible framework with more opportunities for coming in at different stages, for constant communication, evaluation, and checking in with communities. So we're going to show the picture soon, but but Brace 2.0 is actually set to be released in February of 2025. And actually, the thing I'm going to show you is a little bit of a sneak preview, but has been sort of ready and out there and being talked about. There it is. I build up some anticipation. So this is Brace 2.0, and actually, if you'll notice, the name is different. It was Building Resilience Against Climate Effects, and now it's Building Resilience and Climate Equity. So still Brace, with them, like it's like I said, a little bit more of a fluid process, meant to start at get ready, stay ready. But we realize people come to this work at different moments. People come to this work, health departments come to this work in moments of emergency at times, and can't always do things in a rigid 5-step process. So we've made it a little bit more circular. You're meant to iterate on this, and we've incorporated these 3 cross-cutting activities: collaborate, communicate, and evaluate, to be done throughout at all of these stages. So this beautiful image has been cleared and out here for about a year. And what we've been doing for the last year is working with those experts and health departments and community partners to create really robust implementation guidance. And that's what the holdup has been, as that gets through clearance. But we're going to be excited to fully release this new framework in February and help it guide the work of state, local, territorial, tribal health departments across the US. In addition to, oh, here we go. One other new element of the BRACE framework are these cross-cutting principles. This was not included in the former version of that. One got cut off there. It says prepare for and respond to the negative health impacts of climate change. But these things like, prioritizing community experience, centering justice and understanding injustice, working across sectors. These are things that are really, really fleshed out in that implementation guidance that is coming in February that we are excited to bring to all of you, and are really central to the work that we're trying to help health departments prioritize and focus on. Again, many do not have the resources, so there's quite a bit of guidance as well on leaning on partnerships to help extend capacity for this kind of work, working with nonprofits in your area that can help facilitate community engagement and can help facilitate some elements of this work that really do take a lot more time and trust. So we also work outside of the CDC partnership to create trainings and resources for health professionals to better engage in this work, to better follow those steps. We have this training online right now. We worked on it with our environmental justice partners at the Science and Community Action Network. It's called Building Trust-Based Community Partnerships for Public Health Professionals. You can find that on our website, apha.org. And we'll be continuing to bring brand new trainings like this one following the release of the new BRACE framework for health professionals across the US. And that's it for me. Thank you.
Thank you so much, Catherine. And thank you again to all of our panelists. I really could not imagine a better panel to talk about climate and health equity. And we can take down the slides. I think that we are done with slides today, so folks online can just look at through the main camera lens. But I mean, I feel like the kind of message flowing through this of that the climate crisis is real, it is global, and it is also local. It is here right now, and the impacts are striking, and they stack and layer on top of existing health disparities. We see those maps, we see this data. It is extremely stark and distressing. This is an intersectional crisis, and we know that the solutions for this also need to be intersectional, that the kind of action that we need to take around health equity or health justice really needs to work across our subsectors and silos to respond to these threats. And that health centers and health departments are uniquely positioned in their work and their commitments to health equity to address this crisis. You're already doing this work, whether you know it or not. And so really broadening the lens and bringing in more resources and more action are really what I feel is the next step. And it's so energizing to see both how institutions like Sun River Health and the national organizations are rolling out new resources and tools to support this work. So I'm just extremely energized by this. And I want to leave time for the audience to send in some questions and speak, but I just have three quick questions to put the panel. So first is the elephant in the room. I think it's going to be the elephant in the room for the next 6 weeks or so of politics. So I think I talk a lot with people who see climate change as being extremely politically polarized with their audiences, and sometimes even health equity in some regions are things that are difficult areas to broach. So, kind of in your experience, how do you bring these subjects forward in a productive and engaging way? And I'll let whoever wants to jump in first go for it.
I'll start. It's a great question. It comes up a lot. And I'm very sensitive to that question because I could not do the work that I do in the Center for Health Equity and a lot of other places in this country. And one of the biggest things that I've been thinking about and our team has been thinking about is this concept of civic engagement, and really expanding how we understand that to really thinking beyond just voting, because it really disempowers people if it's every 2 to 4 years you stand in line and fill out a ballot and leave, and that's the extent of what you're trying to do. So what we really are, our approach is to have this robust conversation about civic engagement and all that we can do as individuals. There is an individual task that there are individual tasks that we must do, but there's also this collective and this community aspect, which is often left out in medicine, healthcare. The community is the biggest bit, and helping folks understand the options and the work that they can do and to empower folks with pathways to do the work is one of the best things that we can do to really counteract how disempowering it feels when it's such a big problem and it feels like you can't do enough, like you can't throw away all the straws. So really helping folks see that there is a lot of work that is happening and ways that you can support. You don't even have to start brand new. There's ways to tap in. So yeah, it's really through civic engagement versus just voting.
I'll add. So I think I think about this way too much recently, and maybe have different feelings about it every day as we move through this year. We are doing a lot of work, and I think this has been the direction of the climate and health field and movement for a while, to enable local work and local power and local progress. So, as much as everyone is talking about big state and national positions and elections this year in Congress, I always try to sort of revert back to the work that has been going on for decades in local communities, the power that's been building, and the hope that we can continue to get to that. We have done this work through unfriendly administrations, Congresses, in the past, and it will continue to go on. That being said, these elections will have a profound impact on the way that we do the work, on the resourcing for the work. Not only is climate considered politicized, while it shouldn't be, and is equity and health equity considered politicized when it shouldn't be. But since COVID, public health is also politicized. There are a lot of members of Congress that do not want to see any additional money go to the CDC for anything, especially not climate and health. So that is a constant fight that is very impacted by national leadership and electoral outcomes. And I'll just add that when you're talking to people about this work, I think the health framing is so powerful and so important, because I do think that helps reach people on this issue in a way that they can really relate to. I think it was Julian who said, polar bears and ice caps, might not be the framing, right? And we worked. There's a great messaging framework from the Kresge Foundation on values-based messaging around climate and health and equity, and talking to people in the frame of security, talking to people in the frame of health, talking to people in the frame of jobs and productivity and bottom lines. There are so many different ways that these issues impact our lives through their health impacts that you can reach people. There's a bill right now in Congress, this is the last thing I'll say, I know I'm talking too long, called the Community Mental Wellness and Resilience Act. And it is about building mental and emotional resilience in the face of the climate crisis and its impacts. But we do not say the words climate change anywhere in that bill. Lots of disasters and health impacts and all of these things. And that bill has bipartisan co-sponsorship right now. So that's just to say that this is a big issue. There is hope and there are ways to navigate it.
You've said so many important things, all of you. I really, I think that where I go to as a community health center leader is to our boards of directors, to our consumer participation, to first, as we have done with the pledge and commitment to climate change, and our patients, our next, and staff. This is our world and our communities that we're in, and working in that level. It honestly, we're, we're under the radar with our patients and our board, and we're working to do that. I don't think that an election is going to impact that considerably. We have lived, as your point was, we've lived in different administrations, and I have lived through many administrations since 1977 that impact the work that we do in community health. I think one of the positive experiences that we've had that is always a lesson is being as diverse as we are, and certainly as having grown up on a farm and commitment to agriculture, I see that in working in New York City with people who don't have houses, and working in the agricultural country with agricultural workers, this is a very diverse population. We have 250,000, just our world. We've got 30, what is our number now? 32.5 million people, and we can do so much work that it improves the lives of the people we provide medical care to, healthcare to. And to the point, though, that I wanted to make about agriculture, there's a venue there because our farmers, our growers want a healthy workforce. They will engage in this conversation. We have done Apple applications and how to do the to our farmers, to our growers in the Hudson Valley around proper use of material when chemicals are being used, how the workers are protected with chemical exposure. We've done work in the East End of Long Island with glasses to protect our patients. So there are related issues that we can work through the existing hierarchy. Well, it's very different in working in agriculture with farming, with the Farm Bureau, as it is from working with the National Association of Community Health Centers. It's still, there's a reason people are very empathetic to our causes, and they want to be with us and help to support us on a local basis.
I don't have too much to add, but I really appreciated your comment about civic engagement. And in fact, NAC at the national level, we are looking at the vital conditions of health and well-being, if folks are familiar with that. And in the very center is belonging and civic muscle. So we have a lot of really great examples of how health centers are doing that work. Namely one being Vote ER, being available at many health centers across the country to develop that out. But also, I want to go back to my shtick, which is partnerships are an incredibly important part about how we talk about this, about how we engage in these issues. So the health center, in a lot of ways, and to your point, they're starting with people and sticking with people. So what is it that they can talk to their patients about? It's, oh my gosh, it's hot outside. Like, what are we going to do to keep you safe about this heat? So really making it a real tangible impact to the health and well-being of the person. But then they're also engaging in these really great partnerships that may be able to tackle some of those more structural issues. Like one example is UMA Community Clinic, again in California. And there's a lot of urban oil drilling that's going on in Los Angeles. And they were able to work with other community partners to talk about this issue, to talk about how the urban oil drilling was impacting their patients' health. And that was a really important avenue. So again, focusing, at least for the health center, focusing on the health impacts and then building civic engagement through partnerships and just being in community with lots of different groups who are working on these issues.
I'll just say that having an overpowered panel means that all of my questions get answered at the first question. So I get to cross everything off immediately, which is also good news because we don't have a ton of time left. And I do want to offer the audience Q&A. Let's see right here and then here. I'll just walk the mic back.
Hi. Oh, I'm Kiana. I work with the Climate Center with APHA. And I had a question for the Community Health Center folks. And I appreciate you explaining all the work that you all do and how community health centers serve the community. But I think what I was missing from the presentations was an explanation on how you all are working to minimize the medical waste that health centers produce. Um, and also knowing that a lot of that pollution goes into those communities that you serve. So wanted to kind of like gain an insight in like what are the sustainability tactics that you're working towards and how are you all reporting that out and also sharing it with the community as well. So,
And do you want to start? Or?
I'm going to start with turning the mic over to Ben Bolton, who works with me, because I'd like for Ben to answer that question for Sun River Health.
Really important question. About 8 to 10% of greenhouse gases in this country come from healthcare. So, you know, we've seen the enemy and he is us. And certainly upstream is a real problem for healthcare. Community health centers, unlike hospitals, don't have the same level of upstream waste. It's actually fairly low, but we are working with our mainstream suppliers on a methodology of reducing that waste, looking at the whole life cycle analysis, minimizing plastics in particular, looking to other options of sterilization. Jody Sherman up at Yale has done a great deal of work on this that's really valuable, and we're building on that, looking at centralized sterilization for infection control. The other thing that we're doing for our upstream emissions is looking at our energy sourcing, and we've been able to do some significant reductions without necessarily building renewables on site, but by joining community solar, looking at renewable energy credits and other things to minimize that, as well as most of our facilities, even though we don't formally file LEED certification, we build to LEED standards. Hope that answers.
And then I'll just add to one conversation that I've had specifically with Ben is it's really hard for health centers to use the current tools that are out there related to measuring emissions because they've been designed for other folks that aren't health centers. So as Ben was explaining, health centers look different than hospital systems, but the current tools that are available to measure these emissions have largely been designed with these larger hospital systems in mind. So it's a lot harder for us to dig in and really calculate our emissions, but it's something that we're invested in, that we're looking at. We've been also promoting that health centers join the National Academy of Medicine, National Climate Action Collaborative. And we know that there's some really good resources in a map, right, that can get health centers thinking more about this. And we do have a number of health centers that have also signed on to the climate pledge, which Anne mentioned, but that seems to be a big issue. Is like, we need to really understand how to look at our emissions, measure our waste. So I don't have a great answer for you, but I'm just saying that it's definitely an issue. Folks are interested. We probably don't have the right tools right now to do all that we want to do, but hopefully in the future it'll get better.
Thank you. I have a question about community education. My name is Todd Sack. I'm National President of Physicians for Social Responsibility, and I run the My Green Doctor program. My research is on asking patients, what do they want to know about these topics, and how do we get them information in a way they can use it? My question is, how do we reach patients in your experience, and are we being successful in getting the information they need?
I'll start. In my work at the health department in this health equity capacity building role, a part of what we do is support providers. And so the approach that we're taking as a local health department is integrating climate awareness, climate messaging, and really encouraging folks to integrate climate in natural places, in the exam room, in the conversation, and finding ways to casually bring it up, finding ways to address this hot button, hot topic issue for some, just like we address other hot topic issues, like taking a sexual history, for example. We talk about sensitive things, we talk about these things. It's just really helping folks know and understand that. I mean, it often comes up. People are like, well, if it was important, my doctor would tell me. So we're letting the doctors know that it's important to tell folks and let them know that this actually is impacting your health. It's not just, the weather's hot today. Like, this can be a threat. If you're over 80, if you have all these conditions, et cetera. So it's really about integrating it into the conversation they encounter. I think the other thing is really understanding the limits of our medical training. We often don't get this comprehensive education on the impacts of climate change and weather. It's kind of more episodic. After a marathon, someone may have something or certain kind of like specific thing, but it's not this broad understanding. So the other thing is supporting and recognizing the limits of the training that folks receive in a way that's non-judgmental and calls people in to their role and their responsibility as providers, as people in the community, to address these emerging health issues, just like we did with COVID. So there's ways to integrate it in a natural way. It's a part of the conversation that doesn't shame folks for if they feel as if they're coming to it too late. And I think that's the best way to do it versus mandating things or other things can only build up resentment at this point.
And I'll add to that. This is something that we've been really taking seriously at Eco America, kind of addressing some of what Dr. Watkins mentioned, that we want it to be really easy, that physicians are pressed for time. So we want to give them scaffolding to have these conversations with examples. We developed the Climate RX badge and toolkit as one way to kind of bring this up, to have conversations about climate that have a natural on-ramp and off-ramp. You can just say, scan here to learn more, and then you're not on the hook for a 45-minute conversation about something during a very brief visit, as well as a training program really aiming to get people over the hump of feeling comfortable talking about climate change. To have an online self-paced training. We've just mentioned that we've customized this with NAC, that really aims to get people grounded in climate and health impacts, and then most importantly, how they can how to communicate with patients and communities in ways that drive people to take action and understand health protection as being linked with climate action.
I just wanted to add really quick. I'm Todd Dorman. I'm Chief of Communications for Sun River Health. To add, we were talking earlier, Ben and Ben, the Bens, about the patient voice that's so important for community health centers. And so for us, for Sun River Health, providing material, when we find from the doctor-patient conversation someone who really wants to get more involved and become an evangelist for all these things, that they have the resources and they can go get those things and then bring them back in different committees or councils we have to hear the patient voice as an organization and then continue to build on a local level.
I'll follow up, Todd, on a couple things that we have. One is a plan that I would like to see put in place. And it was really stimulated by the kind of notes that we get, the alerts that we get under the weather. When there's a smoke in the air, we have gotten air quality measures. Now, I don't know why I get it, but I thought everybody who has a cell phone maybe gets it because it's under a weather report. It comes through. It says in that alert that if you are suffering from cardiovascular issues or respiratory issues, you should plan to check out, you should put in effect your plan. Now, I'm thinking, how in the world are we going to put in effect our plan But the way to do it is to start in our clinic, to start with the health center, at least for us, in massive understanding of who our patients are, making sure that we're doing in our self-management goals, establishing self-management goals, those who are living in our whole population, basically, noting what their self-plan would be under an alert like that. So working with our patients on an individual basis. But those alerts can be, you talked about La Raza, Clínica de la Raza, is amazing at what they're doing, because that's what I want to do. And we haven't done it yet, but we'll do it. And that is an alert goes out to our patients specifically who are identified as high risk and are with those indicators of what the high risk is. That's one. And then with all the talk about social drivers and social determinants of health, social care networks in New York with the 1115 waiver, it's I guess a bit frustrating that climate change, climate impact is not included on that regular routine screening that we're going to have to do. And maybe, because I haven't looked at the CMS screening, that we all have to implement for every single one of our Medicaid clients in New York, they will have a social screening done. If that screening is done and included in there is impact of climate, then we are at least having that conversation with every single population that we care about for sure in the Medicaid clients first, and then we have everybody else that we will deal with. But I like the idea of building into Prepare, and that we have a tool, but that Prepare tool is not going to be able to be used in New York after the implementation of the CMS guide of a new screening tool. But I think we have ways, we have roadmaps now. We can get there in improving the communication with our patient, not necessarily in leaving it in the hands. Our clinicians, if we add another ask on the electronic health record that they have to, another click they have to make, we're going to get a lot of pushback because they just don't have the time. And by alerting our patients to say, hey, wait a minute, I got to have this in my plan, we can go a long way. Empowering our
And
patients.
I'll just add real quickly in general for community engagement outside of the exam room, right? For reaching people in the communities that you're hoping to serve. Where are they already gathering? Where are they? Who are their other trusted messengers outside of their personal doctors, right? We don't get to do a lot of place-based work at APHA National, but we do some through our Smart Services Initiative. We work in 10 US cities on built environment solutions to decrease urban heat and flooding. But in that work, reaching out to local neighborhood organizations, environmental justice organizations, faith congregations, going there, speaking at their existing meetings, meeting people where they are, is definitely, in our experience, one of the most effective ways to reach broader swaths of people.
Or can I just add one quick thing because I loved what you said, sorry. But Anne was mentioning that, the providers, they don't have a lot of time. We recently were talking with providers about implementing heat guidance. When patients come into the exam rooms, they told us they have less than a minute to talk about heat. So what they have been doing is working with the other folks in their care team at the health center. So that includes the front desk staff, who oftentimes speak the language of the patients that they're, that are checking in. So really incorporating like a whole kind of organizational idea about, some of these messaging, where can we incorporate it in different parts of the organization or through different parts of the care team. But all that being said is health centers are extremely taxed right now, but there are some that are finding really creative solutions to talk about this within their organizations.
Hi, my name is Jessie Liu. I'm actually here from La Clínica de la Raza, just happen to be in town. Great to meet you in person, Todd Sachs. I think I've also spoken with you over the phone. I'm the physician lead for the text alert and the nature prescriptions project. And here to learn because just really admire what Sun River is doing. And in particular, one of the things that I'm hoping to bring back to La Clínica de la Raza is around what your approach has been to patient advocacy. Has it been more direct organizing patients, bringing them more around issues, bill-specific things locally. Are patients paid for their time? Workshops, also opening up the question to others with regard to what you've seen nationally. Thank you.
Do you want to start with that one? Or
You're meaning individual patient advocacy. Of course, I'm going to the advocacy level of our
I'd be curious to learn from you as well as what your, I think Ben's experience or someone back there had spoken about how they identify patients who are, who physicians or other staff may identify as being particular advocates to elevate their voices directly as opposed to being just a voice for them.
We haven't done enough of that. I would hate to answer that question. It's such a good idea. I do believe in empowering our patients to work in this front, but I think that this is something, unless I could ask Jenny or any of the staff at Sun River of your experience, are we doing something that would be helpful in this case? I think it's our bigger communication issue. And we have a strong advocacy. I think bringing to the table for our advocacy agenda it's more elected official advocacy. We've been doing that more and more. And so community advocacy in that way, in some ways touches the empowering patients, but it's not what I don't believe that's really answering your question. And so I would ask Jessica, if you have experiences with other health centers that are you the chief medical officer?
No, I'm a primary care physician and
That's
physician lead in the
with us.
climate health group.
Are you
Yeah.
staying long?
I'm here visiting friends. It was just in Brooklyn, 3 miles away, and woke up this morning. I was like, this is happening. I'm gonna come. That's why I'm in like street clothes. But yeah.
well, thanks, Jesse. And I'm so sorry I didn't notice you were in the crowd because I would have definitely called on you to talk about the great work at La Clinica. I also don't have a great answer, and I would love to talk with you after to start thinking about that more because I think that's a really important thing to start thinking about and addressing. And I would maybe if I could, have you had any success in that, or do you have any just like initial ideas or thoughts that you would like to share? If not, no pressure at all. Or yeah, Doctor would love to hear.
I mean, if you're as you think through your response, one thing that I would offer, we use in the Department of Health in New York City, we're really focusing on this model called the Public Health Core. And it's a big effort that started in the COVID pandemic to really help support and bolster the public health infrastructure, public health workforce in New York City. And the model really centers around community health workers. And really what we recognize is we often look at lived experience in this way where it's not the same as our degrees, et cetera, but really looking at the situated knowledge that communities come to the table with. Situated knowledge comes from like psychology, terminology, but really understanding people who have specific historical, cultural, linguistic knowledge that is located in a place of that they have grown and are aging, et cetera, that you can't get from the books. And so really empowering the folks from the communities, not to save them, but to empower folks so that we can help create the conditions for folks to be able to do what they need to do. And so what in our model, what we do, we create networks, we create space so folks can come together and really integrating this civic engagement conversation, encouraging folks to have coalitions, opening up in our neighborhood action centers, opening up space so that people can use it to organize and do what they need to do with no charge. Giving folks access to the facilities so that folks can do what they need to do and handle their business in a space that looks beautiful, and inviting. So folks feel as if they do belong, as if they do, that this health center that was built in the center of their neighborhood is for them. So there's ways to really activate a space, to call people in and to help just create the conditions. I think is one thing that we can think about and do a bit more of, because we don't have all the answers. Folks may be walking in the room with the answers that the community needs, and all we have to do is to keep the lights on, you know? So it's really creating the conditions for folks and really sometimes just listening, just having folks come in and just listening, kind of see what do they want, how do they feel as if they could engage, because what's good for Flatbush may not be the same thing that was good for Long Island, or may not be what's good for East Harlem. And it's really just having the capacity to be nimble and to respond in a way that the local community, so that the local community can handle the work that they've been doing for years.
Well, I have to resist my temptation to dive into this subject. I think this is something me and Jess have chatted about here and there, just the idea of having kind of a promotores de medio, like community health promotion focused around climate is something I'd be so excited to kind of explore and dive into. But we don't have time today. We started 15 minutes early. We are ending 15 minutes late. I started 15 minutes late, ending 15 minutes late. I want to thank the panel again so much. Thank you. And of course, a huge thank you to Sun River Health for hosting us. And their generous offer for all here in person to join for a tour of the Community Health Center, if that's still on the table, if we haven't run too late.
Nando, can you raise your hand there? Stand up.
Yep.
There we go.
So anyone interested in touring this beautiful space, please grab onto Fernando. And of course, there's breakfast in the back of the room. Thank you again so much for all of this time. I really appreciate it. And for those listening online, we'll be sharing the recording afterwards with everybody and also following up. Thank you again so much for your participation.